Welcome to the Tech Talks Daily Podcast, where you can learn and be inspired by real-world examples of how technology is transforming businesses and reshaping industries in a language everyone can understand. Here is your host, Neil C. Hughes.
Welcome back to the Tech Talks Daily Podcast, where ironically, as I sit down here today to record a podcast about health tech, I have a tragic case of man flu, but it's nothing too serious. I just apologise if you hear any sniffling or me trying to stifle a cough, but rest assured, you're not going to catch anything, so you're in safe hands still. And as you all know, the COVID-19 pandemic brought the importance of a timely, detailed and comprehensive data right to the forefront, because to help curb or prevent another pandemic, many leading institutions are actively discussing whether and how global data sharing should be established and governed to more quickly detect the risk of future pandemics and disease outbreaks. So a company at the forefront of this new collaborative approach is HSR.health. And the health tech firm successfully adapted its health risk index to improve the pandemic emergency response efforts with hyper-focused risk indexes that nations and public health agencies have adopted around the world. So buckle up and hold on tight as I beam your ears all the way to Washington, where Ajay Gupta is waiting to share his story and tell us all about HSR Health. So, a massive warm welcome to the show. Can you tell the listeners a little about who you are and what you do?
Absolutely, Neil. Thank you for having me. Thank you for taking the time to speak with us. And my name is Ajay Gupta. I'm the CEO of a health tech firm called HSR.health. My own personal background is that I've worked in cybersecurity and information technology, or IT, for a long time, and have seen companies create true competitive advantage and truly gain value in the marketplace from the successful management of tech initiatives. At the same time, I think we all see that healthcare is burdened with outdated technology infrastructure and numerous inefficiencies, which in the healthcare field, Neil, because of what they do, is measured in human lives. So my goal is to try to help. We want to help disrupt and innovate healthcare by leveraging technology to address key public health problems and leverage tech to improve healthcare quality, lower costs, and achieve real health equity. That's our goal.
Now, you mentioned quite a few things there, really. So cybersecurity, IT, healthcare. So I've got to ask, can you share your origin story, where your passion for tech came from, and what put you on the path today, and how the worlds of tech and healthcare pretty much collided for you?
Sure. Thank you. I always love talking about the origin story, right? And maybe because I'm a big Marvel cinema universe fan, I love all the origin movies. But we really got our start, myself and my chief medical officer, who's a partner in the business, were watching President Obama's first inaugural address back in 2009, where he said we're going to wield technology's wonders to improve healthcare's quality and lower its costs. And right there, we sort of looked at each other and thought, look, in all of the debate on healthcare, there's almost no debate on the fact that technology hasn't revolutionized this industry the way it has all other industries in the world. And so we started thinking about why and what we could maybe do to help that. So we started ideating on that. And we think we know why and how to use technology that can help within integrated clinical workflows to achieve improved healthcare quality and lower costs. And HSR.health is a result of those efforts.
And like you said, that path you took there, it led you to HSR Health's GeoHealth platform that, from the research I've been doing before you came on the podcast, it merges data on social determinants of health with social media data, health outcomes and cost to extract clinical insight. But can I ask you set the scene and tell me a little bit more about the problems you're solving with technology?
Absolutely. Thanks. That's a great question. And you're right. That's what we do. So what we determined was that we need a solution, or healthcare needs a solution that brings together all of the data on the factors that impact individual patients' health outcomes. Generally in a hospital, they may have, but they may not have, a patient's entire clinical history. They may only have the data of the patient that they see at the moment, right? All of the social factors that the patient lives with, may have zero visibility into that. And we know today that what we call social determinants impact 80% of all patients' health outcomes. So if you're not including that in diagnosis and treatment, there's going to be some inefficiencies. Our system brings together social determinants data, as you mentioned, social media data, because we talk about all aspects of our lives in social media. That's a great place to learn about health problems in the community. We bring that together with population level health outcomes and cost data and can really extract relevant clinical insights that are helpful at diagnosis and treatment at the point of care, as well as can do broadly track the spread of infectious disease, identify the resources needed to mitigate those diseases. Of course, the most famous infectious disease today is COVID-19. And we can do those things, help public health respond to natural disasters and pandemic level disease outbreaks without crashing the global economy.
And can you walk me through how you do this and the kind of data that you use and how you unlock value from that data too?
Sure. So what we do is the value we unlock is through the analysis of our geocoded health, social, and environmental data sets that we sort of just talked about.
Yeah.
We extract clinical insights from those social determinants, and I'll talk about what they are in a second, to improve diagnosis and treatment at the point of care. Social determinants of health, in our view, is really just a term to define the world we live in. So that does include things like population and demographic information, race and ethnicity information, but it also includes things like the transportation networks that a person has access to, the environmental conditions in the areas that people live and work, and a lot of these things that may be outside of a person's individual control, climate change, for instance. By analyzing all of those, we really understand what stresses are on the health of populations and can assess then how to mitigate those stresses to improve health outcomes. And that's where the value is, right? How can a society, whether it is at a true wide population level, like a national Department of Health level, or individual health system, may have one or two hospitals in a region, or even a clinical level where a physician is treating a few patients. At each of those levels, improved ability to diagnose patient risks and intervene is of great value, in part because we know healthcare costs are so high, and in part because if you can do anything to improve the quality of life of individuals, well, we have just raised the quality of life of the entire world, really. That's the value that we unlock.
And of course, we're also approaching, nearly 2 years since the COVID crisis swept across the world. So can you tell me a little bit more about how you also, I believe, adapted your health risk index to actually improve pandemic emergency response efforts too, because it's such an important topic right now.
Absolutely. And it looks like it's going to remain an important topic, at least for the balance of this year and perhaps into early part of 2022.
Yeah.
So in 2019, Neil, we learned from our colleagues at FEMA, which is our Federal Emergency Management Agency, and our U.S. Public Health Force, that one of the things that they have challenge with is knowing the health needs of a population. They typically learn that once they get on site after the disaster, which of course, is late. There's a delay then in providing care, which costs money and lives. So we told them that's a problem we can solve. Since our system of analyzing social determinants and outcomes can be predictive, we developed for them a geospatial application that fits within FEMA's existing protocols and applications for managing large disaster response, fits within their systems, that can detect a priori the health and medical needs of a disaster-impacted population. So they can plan for the delivery of those needs as they plan for their overall emergency response. And that was in 2019, just before we were hit in 2020 by a pandemic. So we were in a position to take what we did for emergency response to things like a wildfire or a flood, a hurricane, and adapt it to a pandemic, really, which is a natural disaster of an infectious disease. And now we have built, and since then we have built many additional models that track the spread of infectious disease, like COVID, that identify who amongst the population is at high risk, so as well as what resources the health systems will need, whether it's PPE or other equipment and devices like ventilators, to treat the infected population. And health systems have used our insights to plan for staffing and resourcing over the course of the pandemic.
And I suspect that there will be many people listening that when they hear things like healthcare, data, social media, all put into that same box, some might be concerned about data privacy and some might even deem it creepy on the surface. So I'm curious, from your point of view, how do you find that right balance with your platform and also protect their data at the same time?
We don't track patient clinical data. Yeah. We don't use any personal information. Ultimately, we have a mission to help the world by lowering healthcare costs and achieving better outcomes. HSR.health doesn't think that means we have to invade people's privacy. We are a health tech firm. We're not a data tech firm. We're not a data broker or a data seller. We're health tech. So I completely understand where this question comes from. And I agree at a very significant level that we as a society need to come to terms with what it means for our data to be so widely available and decide how we want to react to that, how we want to, either allow for it and adapt or maybe change that progress. However, as a population health firm, we don't use any patient clinical records. We use social determinants of health data, which is aggregated at a population-wide level. We use healthcare outcomes data, which could be even at national levels, and cost figures. And from those sets of data, we extract intelligence that can be used at the point of care to improve diagnosis and treatment. At the point of care, health systems, your family physician, is still the one to see personal data, not us.
Excellent. And can you also expand then on the benefits of health-focused geospatial analytics, especially in aiding pandemic response and mitigating future risks too?
Thanks. Yes, we look at health outcomes holistically. And we see that social determinants play a dramatic, influential role throughout the healthcare system, outcomes with costs, with why individuals may get sick or stay sick in the first place. And so in terms of benefits of looking at what factors play a role in health outcomes at the local level, we can help physicians and health systems, and even broadly, even industry, understand what may be going on in people's lives on this part of town versus the other part of town, in this city versus the city on another portion of the country, right? And those regional differences have a substantial role to play in health outcomes, or even in what kind of healthcare a person needs to receive. And this benefit of adapting how we provide care for individuals based on where they are, based on the factors and the society, the social circle that they live in, is very important in terms of making sure that we're getting individuals and communities the specific care they need that meets them at where they are in their lives, in their care journey.
A quick timeout from the interview to mention HireAct, the sponsors of the Tech Talks Daily podcast this month. So recruiters, are you or your business spending too long in your email and waiting for responses? Did you know that with HireAct, you can skip the headache of traditional hiring? You can view resumes, exchange contact info and interview candidates in seconds. You can also get curated candidate recommendations that fit your job requirements. You can chat directly with your ideal candidates, accelerate your hiring process 10 times faster than those painful traditional ways. And best of all, it's a totally free download from the Apple and Google Play Store. So download HireAct from the Apple or Google Play Store, give it a try, and let me know what you think. But now, back to today's interview. And I am conscious we're covering a lot of information in a short amount of time here. So do you have a use case that you could possibly share that would help listeners understand the data captured and the difference it can make and just bring to life really everything we're talking about?
We do have some use cases. How much time do you have? Well, one of the things that we're really very proud of is, I'm sure you heard and your listeners heard, because this is a global problem, that there was a shortage in personal protective equipment for our frontline workers and those treating COVID patients, not just here in the US, but everywhere in the world. So one of the things that we did was to use our system to anticipate the level of patient load at specific healthcare facilities, whether they are a hospital, a clinic, what have you, so that, and estimate that load for an entire wave of the pandemic, right? And that's based on understanding the amount of people in an area, understanding the case counts of COVID, the level of mobility, and other immunocompromised factors, right, in the community to anticipate how many people will get exposed to and succumb to an infection of COVID-19. And that number of people will potentially result in a required hospitalization. And based on that information, as well as information on how many people work in the hospital, we were able to identify the specific level of PPE need by type, like gloves, gowns, masks, by facility over the wave of the pandemic. And this did really two dramatic things that helped the entire supply chain industry. One, it allowed healthcare systems or stockpile managers to place future orders for PPE where they could have a security on delivery, but pay the price later on in the future when PPE prices would come back towards normal. And suppliers, the entire supply chain, would have some visibility into future need, and they could, to an extent, schedule delivery, schedule production, manufacturing, delivery based on those needs, based on that sort of calendar of need. This was very helpful. It helped hospitals to plan staffing and resourcing over an entire wave of the pandemic.
So looking towards the future, is there anything you can share about what's next for HSR Health? Because there's so many big tech trends in health tech at the moment, but I appreciate you probably can't share too much. But is there anything you can share about the road ahead for you guys?
Oh, absolutely. Absolutely. We like to consider ourselves a transparent company. We want to take everything we've learned on the relationship between social determinants and health outcomes, on tracking the spread of infectious disease, all of our risk analytics and health insights we've produced to build a truly global digital disease surveillance and intervention solution. We're talking about a solution that can predict or issue an early warning for outbreaks of endemic and emerging disease, and then identify actionable and reasonable countermeasures to control the spread of those diseases without countermeasures that don't require shutting down of the entire global economy, obviously. That's really the goal and what we're headed towards. We see that really, if we think about it, even though we've sort of been living it so much, digital technologies are very new. Digital technologies are far newer, younger, if you will, than the risks of pandemics, which go back into our history as a species. So we really haven't had the opportunity to broadly deploy digital technologies like disease surveillance and intervention capabilities against pandemic disease or any disease in the past. This is our opportunity, sort of spurred on by the horrors of COVID-19. We have the opportunity to build and deploy new systems to protect global human health at a level that we haven't had before. We are very excited. Our entire team is excited about this opportunity. And really that is what is next for HSR.health.
Well, I wish you the best of luck for the future with that. But before I let you go, we did start the podcast talking about what put you on this path, how the worlds of tech, cybersecurity and healthcare collided to put you on this path. But I'm now going to ask you, what's been the soundtrack to your career in tech? Is there a particular song or piece of music that has accompanied you in your career or just helps you get your head in the zone?
I really appreciate this question, because music is the soul of our company. We really are gravitate to it. My chief medical officer, my partner, as I mentioned, is an accomplished guitarist. Members of our board are self-taught guitarists. Our chief geospatial engineer that sort of manages our technology infrastructure, he is an accomplished keyboardist and DJ. I love with passion to sing. So I, take lead vocals, and others in our company join in. So there are a lot of songs that are in our repertoire. But one that sticks out for me, one that we have performed many times, is Take It Easy by the Eagles. I would be delighted if your listeners would tolerate to just go ahead and do a karaoke version of the song right now. But I specifically like that lyric of, take it easy. Don't let the sound of your own wheels drive you crazy. That really speaks to us. I think that no matter what we're doing, we do have to take it easy. We do have to make sure that the small things that get in the way don't trip us up. And also, I also interpret that line in another way, to say that no matter how, if you will, great we think we are, no matter how impressive and world changing our solutions may be, let's not take ourselves too seriously either, right? Just got to take it easy and just keep doing what we can do to contribute.
Oh man, what a great song and a great choice and a great story behind that too. I'll be adding that to our Spotify playlist. And it sounds to me like you've got enough band members to create your own band there for HSR.health. Are there any gigs lined up for you guys? And if not, why not?
because I can't convince everybody else to do it. I think that would be fantastic to put a band together. And Chief Medical Officer has been in a band. That was part of his life. His name is Ram. I keep mentioning him. But he's been in a band, and I certainly love to sing. So I'm not a stranger to karaoke night, I tell you, at the local pub. So we got to get it done. I agree with you.
I love that. Well, there's so much I love about what you've done here with your technology and at the forefront of this new collaborative approach at HSR.health. I'd love to stay in touch with you, see how this evolves and get you back on next year. But more than anything, just thank you for taking the time to share your story and also wash that down with a great song choice too. Thank you so much.
Thank you. Thank you.
A big thank you to today's guest for sharing the many benefits of health-focused geospatial analytics and the role that can play in aiding the pandemic response and mitigating any future risks. But I'd love to hear more about your insights, your experiences, and your opinions on the best way forward and how we can use technology to deliver a more proactive than reactive response. So keep your messages coming in to techblogwriter@outlook.com. Remember, my website is techblogwriter.co.uk. So thank you so much for listening and putting up with my cold-ridden dulcet tones today. I will return tomorrow. But until next time, don't be a stranger.
Thank you for listening to the Tech Talks Daily Podcast with Neil C. Hughes. Remember, technology works best when it brings people together.